posture is an important part of our overall health. It can impact your weight and even your mood.
Wellness coach Andy Liu stopped by to share some ways to improve your spinal health and change your mindset too. Check it out.
Okay, so tell us, how does your posture affect your mood and your weight?
Well, you don't see depressed people walking around with fantastic posture, right?
True. Yeah.
Everybody's in the fight or flight when we have, depressed negative thoughts, and that's because there's literally less blood in the brain, and it's all to the extremities, because that flight or fight response, I guess, is going to make you want to run away from the lion or wrestle it to the ground.
Okay, so that means you slump over like this and then you start getting fat right here?
Well, apart from the obvious look of, now everything's condensed and of course, but engaging that core, because the spine is strong and because the muscles are holding the spine in its correct posture, lengthens everything up. But not just from a visual effect. Housed inside the bones of the spine is the spinal cord and the nerves that branch off that. And it's through the nervous system that we perceive the world, adapt to stress, and coordinate all bodily functions. The nervous system's the master controller. It controls the digestive system as well.
Okay. So if you are able to get your nervous system through your posture aligned,
right,
in theory, then you have a better chance of having a healthier overall life?
I love the way you're thinking about this holistically, Amy, because, wellness is about that holistic view, not mechanistic view, and it's also about being proactive rather than reactive. So proactively, you want to make sure that the spine has an S bend this way. It's actually not straight. It has to have a curve in the upper area here because it supports the weight of the skull. So sometimes when we're stressed, we come forward in this boxers type posture. But actually, that means that the spinal cord housed inside the bones starts to, have this distorted signal as it cranes forward. So now we're like this, and then we've lost that beautiful elasticity and the clear communication from brain to body that's supposed to tell the digestive system to work better, and perhaps the metabolism might even work better. That happened to me. I was actually, when I discovered chiropractic care and changed my posture through chiropractic adjustments, I lost 10 kilos within about 3 to 6 months. I was already, eating well, and I was actually an aerobics instructor.
Oh.
But my elimination process just wasn't working well. So as soon as, the pelvis in particular, those nerves that go down the leg, and I had sciatica, so the choke nerve down the leg, those same nerves branch off to the digestive system. So once you free up that communication, naturally the body starts to function the way it was designed to, with clearer communication.
Okay, so how can you make sure first that you have proper posture, and if you don't, how can you correct it?
Well, obviously we're in a sedentary environment now. I think, this is the new epidemic. We're spending up to 8 hours or more in front of our desk jobs and our phones, and it really, really concerns me what's going on. So it's not just the stress, but it's the physical and environmental stressors. So what we have to do is obviously get checked by a doctor of chiropractic who's done 5 to 6 years at university level training to detect nervous system interference and check your spine with objective measures of care like x-rays or posture tests or whatever they do. But we can just look at ourselves in the mirror too and go, is my chin in line with my ear? So sometimes, if you look at it side view, if your chin is this, then your ears don't line up with the shoulder. So you want to pull it back so that the ears line up with the shoulder, and you're kind of giving yourself a double chin.
Oh, we don't want that.
No,
but we can just practice it while we're driving. Make sure that the head is touching the back of the car, for example, or you could be sort of at home and put your chin back, against the wall, and just do that to release some of the tension from the nervous system. It's a neurological stretch, and I've got so many more in my books and the work that I do, some neurological stretches that you can do to improve that spinal cord and function of the spine itself.
So you don't have to see a chiropractor necessarily to start fixing it. You can start fixing it on your own, but probably see a professional overall.
Yeah, I mean, probably, because I think the average age of somebody by the time they see a chiropractor is 30. So what kind of degeneration has set in up until then? So we could all benefit from seeing a chiropractor, and also to have it monitored. And they are primary healthcare practitioners, so they could probably, I guess, look at everything else that's going on. And then there are some adjuncts that you can do to assist their care as well, on a nutritional level, moving your body and making sure that your ergonomics are set up well in the home, in the car, in the office, all those things. We want to actually help fast track that healing.
I don't feel like I have to stand like perfectly straight up.
So I know it's like, so your mom had something when she was telling you, stand up straight, stand up straight.
She did.
What's on her head?
She sure did. And you know what? Just that better thought process that happens literally on a physiological level. Because what happens is the physiology changes your chemistry and in turn your emotional status.
Yeah.
All right.
All right, we're getting stronger.
Yes, we are.
We're going to eliminate better.
Yes. Thank you, Andy. Thank you, Andy.
I already feel better and happier. I mean, you know, just try and be happy like this.
Yeah, that works.
That's true. Thanks, Andy. We've had such a healthy show today.
I know. Stand up
Eating
straight,
healthy,
stand up
learning
straight.
about getting our diets cleared up, standing up
Yeah.
straight.
Oh, wow. Really good.